So, like many people who are mentally ill, I take a lot of medications. My medications are the reason that I can live a productive, happy, and independent life, and I'll forever be grateful for that. In this video, I'm going to be talking about the specific medications that I take to help manage my mental illness. And if you don't know already, my name is Kit, and I have schizoaffective disorder, which is a condition where someone experiences symptoms of schizophrenia, such as delusions and hallucinations, but also symptoms of a mood disorder, either bipolar or major depression. And if you're wondering, I have the bipolar type of the condition. And for the purposes of this video, I'm just going to be covering the medications I take for my psychiatric treatment, not other health issues. And so let's get started on me telling you all the medications I take for my schizoaffective disorder. To start off, I'll go back to the very first psychiatric drug I ever took, and that was Lamictal, or Lamotrigine as it's also commonly called. Lamotrigine is an anticonvulsant that's actually also used to treat epilepsy. And for me, I'm prescribed it as a mood stabilizer, so it helps me with my bipolar depression. I've been on it for 9 years now, and it seriously changed my life, and it's amazing. Like, it works so well. The next one is Zyprexa, or it's also called Olanzapine, and you can pry it out of my cold, dead hands. It's one of the most powerful antipsychotics in existence. And even though Zyprexa is an antipsychotic medication, it actually treats my mood side better than it treats my psychotic side. And I was actually put on Zyprexa because I had delusional thinking and was hallucinating constantly. But when it actually kicked in, the effects on my moods were better than that of Lamictal and lithium combined. And I've been on it for around 4 years now. I did take a break briefly last year when I tried to switch to a different medication, but nothing worked as good as Zyprexa, so I just went back on Zyprexa, and hopefully I'll be taking it until I die. And the next drug is good, old, reliable lithium. Lithium really gets a bad rap, but it's honestly an amazing drug. And the thing is, lithium actually, yes, it treats mania, and that's what a lot of people know it for. Heck, that's what the FDA approved it for. But it's actually really effective at treating bipolar depression, and that's the original reason I went on it. Unfortunately, I wasn't able to tolerate the side effects as well over time, and so I ended up negotiating with my doctor to take a lower dose, and that lower dose does have neuroprotective effects, like dendrites in my neurons are regrowing in my brain while I take it, which is pretty cool. And it also has a lower risk of me unaliving myself, which is also great. So that's why I take it, but I take it at a really low dose. The next drug I take is Zofran, but you also might know it as Ondansetron. It's actually an anti-nausea drug that's used to treat a wide variety of things. For example, they give it to chemotherapy patients before they, well, undergo chemotherapy. But I take it to treat my OCD. Who would have thought that an anti-nausea drug could be used to treat OCD? And Zofran actually really helps me deal with my anxiety as well, because one of the things that happens when I get really anxious is I do throw up. And sometimes if I have like a really stressful thing that I have to do at work, I'll just wake up nauseous, and the first thing I'll do is go to the toilet. However, if I take Ondansetron, the nausea goes away, and so that's really for me where the true value of it lies. And like, yes, it does treat OCD and it does help that, but I'm more in it for the anti-nausea effects. And here we come to the controlled substances portion of the video. So I take 2 controlled substances, and the first one I take is Ativan, or you might also know it as Lorazepam. And Ativan is a benzodiazepine. It's an anti-anxiety medication that I take as needed to deal with severe anxiety. It's extremely helpful. I get 10 pills a month, and that's honestly the perfect amount. And the other controlled substance I take on a regular basis is Ambien, or you might also know it as Zolpidem. The type of drug that Ambien is called a sedative hypnotic. And I'm happy to say that, yeah, it actually does do the sedative thing pretty well. And you might be wondering, okay, Kit, Ambien is not a psychiatric medication, why is it in the list, etc.? And it's because I take it to deal with the side effect of another drug, and that drug is Lamotrigine. So in the early days when I first started taking Lamotrigine, I started having these issues where I would be falling asleep in my classes. I was still in high school at the time, and I was actually voted most likely to fall asleep in class as my senior superlative, and I'm still not sure how I feel about that. But I went back to my doctor and I said, hey, I'm falling asleep a lot, I'm having issues staying awake and whatnot. And as it turns out, Lamotrigine actually keeps you from having deep sleep in some people, and I was one of those people, and so my doctor prescribed me Ambien in order to give me that deep sleep, and I've been on it almost as long as I've been on Lamotrigine, so I think I said 9 years, so coming up on 10 actually, which is wild to me. But yeah, Ambien's a great drug. On to the next one. And I have a few other drugs that are more on an as needed basis, and the first one of those is clonidine. So clonidine is actually an antihypertensive medication, meaning it lowers your blood pressure when you take it, but it also has psychiatric uses as well. It's really cool because it actually works to get me out of a rut when I have the urges to harm myself. And I don't know how clonidine gets rid of those urges. I just know that it does, and I'm eternally grateful for that. And the best thing is that I haven't had to take it in a while, so I still have it just in case I need it, but it's been months now, which is really exciting. And in even more rare cases, I have it to also treat agitation when I'm in manic episodes because I get irritable and irrationally angry at inanimate objects that haven't done anything to me. And I've noticed that when I take clonidine for that, it also kind of calms down that aggression, which I'm also grateful for. And I know I keep saying I'm grateful for this, I'm grateful for that, but like, I'm just really happy in general that I have medications that work for me. So you'll have to forgive my excessive gratitude. The next one is benztropine, or it's also called Cogentin. It's an anticholinergic medication, meaning it actually blocks acetylcholine, which is a neurotransmitter, and it's used to treat Parkinson's. Now, I don't have Parkinson's, but I do have medication-induced Parkinsonism. So I have some symptoms that are very similar to that of a Parkinson's patient, and it's because Zyprexa, that amazing antipsychotic I talked about earlier, messes with dopamine in my brain. And dopamine is a key neurotransmitter involved in movement. So you can understand how messing with the dopamine can cause unwanted movements. And so the biggest thing I deal with is I have a resting hand tremor like this. So when I don't take my Cogentin, my hands shake. And given my job requires me to be very precise and accurate, I have to take it at work so I can do my job, but the benefits to taking Zyprexa far outweigh having to take an anticholinergic medication a couple times a day. Like, it's a solution, it's fine, and I don't have any weird side effects from the benztropine. It just stops the tremors. So I'm super, super glad that works. The kind I have lasts 6 hours, so I take it in the morning and then I take it at night when I'm about to go to sleep, so I don't get like restless legs or anything. And so this next thing are actually supplements I take, and I don't take a ton of supplements. I'm not really big into supplements, actually. I avoided them for the longest time, but my doctor convinced me to go on 2, and I will tell you about those now. And so the first supplement I'm going to talk about is fish oil. And it's not any type of fish oil I take. It has to have a certain ratio of EHA to DHA. And when that ratio is met, it actually helps with mood and depression and some other stuff. So I take 2 massive fish oil pills every day, and I hope they're working. But it's not like I'm going to go off of them. My doctor has me taking them, and whatever he tells me to take, I take. And the other one, and you can pry this also out of my cold dead hands, it'll be right next to the Zyprexa, is N-acetylcysteine. And I originally started taking NAC to protect my kidneys from long-term damage that can be caused by lithium. However, after doing some Googling and a little bit of research, I found that N-acetylcysteine can also be used to treat treatment-resistant obsessive-compulsive disorder. And I'm not really going to talk about it a lot on this channel, but I do suffer from really bad obsessive-compulsive disorder. And when I went on NAC, those symptoms went drastically down. Like, OCD was a really big part of my life, and it was really messing with me. It was really messing with my head, and going on that actually snapped me out of it and helped me return to a normal state. So I take 2,000 milligrams of that, which is pretty high, but it works really well for me, and yeah, pry it out of my cold dead hands. And it's so weird to think that a supplement that I can buy off Walmart.com helps me as much as it does, but I'm not questioning it. Now, if you're watching this video and you're thinking, wow, Kit, that's a lot of medications. Well, it kind of is, because I actually have symptoms of schizophrenia, which requires schizophrenia medication, and I also have symptoms of a mood disorder, which requires mood disorder medication. 2 conditions, 2 sets of meds, it adds up pretty quickly. And trust me, I'm not overjoyed to take over 10 pills every night, but I do it because it helps me. So if you want to share, what do you guys take on a regular basis? There's the comment section down below, of course, but if you want to keep the conversation going on other platforms, I am on Instagram and Twitter at SchizoKitzo. I love talking to you guys about mental health. And that is all for this video. I will see you in the next one. Bye-bye.